We've already put up 2 videos about the coronavirus, and a third one that we don't speak about. We also discussed the virus in the latest episode of our podcast, and all of those things are linked down below. So in this video, we're going to assume that you understand the virus and its ramifications. With cases on the rise, Johnson addressed the nation, Matt Hancock addressed the House of Commons, and the government released a 28-page document explaining the government's plans to handle the virus. In this video, we're going to analyse all of that and explain what the UK is going to do to try and prevent the spread of coronavirus. Before we do though, a quick thing to note. I've already said the word virus 6 times in this video, and YouTube has picked up on that, because huge viruses aren't all that ad friendly. Because of that, our previous coronavirus videos have been demonetised. Take the one we put out on Saturday. At the time of recording, that has about 80,000 views, and has earned £16.60. Yep, £16.60. This video's already cost us more than £16.60 to write and animate, and we're only about a minute in. If you want to support our independence and let us create more content we believe in, then you can support us by buying merch, signing up to Patreon, and donating to PayPal. No pressure, but all 3 things are linked down below. At the time of recording, the UK currently has 85 reported cases of the coronavirus, but no deaths thus far. However, that first number has been going up fairly quickly over the last few days. As a result, the NHS has declared the coronavirus a level 4 incident, their highest category of emergency. So, in response, on Tuesday, Johnson made a speech addressing the outbreak for the first time, alongside Chief Medical Officer Chris Whitty and Chief Scientific Officer Patrick Vallance.
Today we've published the Coronavirus Action Plan, setting out how all 4 parts of the UK will take all necessary and reasonable steps to prepare for and tackle this outbreak. And the plan has 4 strands: containing the virus, delaying its spread, researching its origins and cure, and finally, mitigating the impact should the virus become more widespread. That is, contain, delay, research, mitigate.
As you just heard, there are 4 core elements of the government's plan. The UK is currently in the contain phase, where the government is putting effort into isolating those affected and trying to prevent the virus from spreading around the country.
And our plan means we're committed to doing everything possible, based on the advice of our world-leading scientific experts, to prepare for all eventualities. We will make sure the NHS gets all the support it needs to continue their brilliant response to the virus so far. We must not forget what we can all do to fight this virus, which is to wash our hands. You knew I was going to say this, but wash our hands with soap and water. And forgive me for repeating this, but there will be people first tuning into this for the first time. Wash your hands with soap and hot water for the length of time it takes to sing Happy Birthday twice.
But the government recognises that the containment won't be successful forever, noting that based on experience with previous outbreaks, it may be that widespread exposure in the UK is inevitable, but slowing it down would still nonetheless be beneficial. So in the delay phase, the government would try and take action to try and slow the spread of the virus, preventing a huge spike in the number of patients that need to be treated, and giving workers longer to develop a cure. The government says that during the delay phase, which would be triggered when it's clear that it was no longer possible to contain the spread of the virus, action that would be considered could include population distancing strategies, such as school closures, encouraging greater home working, and reducing the numbers of large-scale gatherings, in order to slow the spread of the disease throughout the population, whilst also ensuring the country's ability to continue to run as normally as possible. The report warns that the number of deaths resulting from the virus can be expected to increase, and that the virus could spread in waves. Chief Medical Officer Professor Chris Whitty remarked that in the UK, probably around 1% of people who get this virus might end up dying, but commented that the death rate could vary depending on age. This is a lower death rate than has been experienced in other countries, as the UK believes it's better placed to handle the crisis and contain the disease. The report also comments that if the virus does become impossible to contain, then it would take between 6 and 8 weeks to reach its peak, with the peak period continuing for about 4 weeks before dropping off over the next 12 weeks. But this spread is not guaranteed, and the virus isn't predictable. So if the virus did become uncontainable, you could see it spreading in waves, or impacting different parts of the UK at different times. In fact, the government document specifically references this, saying that it's possible that an outbreak or pandemic of COVID-19 could occur in multiple ways. It's not yet known if the disease will have a seasonal pattern like flu, and therefore, depending on what the emerging evidence starts to tell us, it may be necessary to ensure readiness for a future wave of activity. To react to the virus and the potential crisis, the government has announced that the army will be on standby. If the army were utilised, they'd be expected to assist struggling public services, filling in the gaps left in the police and health services. The army's primary function would be to take over guarding duties from the police and allow them to focus on other responsibilities. The police also have specific plans to handle the outbreak. According to the government's report, in the event of a serious outbreak where large numbers of officers were off sick, the police would only investigate the most serious cases. They would focus on their critical functions, like responding to serious crimes and maintaining public order. And this is a clear priority for the government, with the report recognising that serious outbreaks could lead to a significant and clearly noticeable pressure on society. The police aren't the only employer mentioned in the document, with the report warning that employers across the country can expect up to a fifth of their staff to be sick at one time, in the worst case scenario. According to the report, this could last up to a month, meaning a pretty significant impact on businesses, especially small businesses. In return, the government is proposing a series of tax mitigation strategies, where businesses affected by the outbreak could be given some form of tax relief. This taps into the existing HMRC time to pay system, and it will be handled on a case-by-case basis. After Johnson's remarks and the release of the report, Matt Hancock, Secretary of State for Health and Social Care, delivered a very similar speech to the House of Commons.
Right, we now come to the ministerial statement, the Secretary of State for Health.
The situation facing the country is increasingly serious. Globally and at home, the number of cases continues to rise, and it's becoming more likely that we'll see widespread transmission here in this country. Our approach is to plan for the worst and work for the best. We finalised our 4-part action plan to contain, delay, research and mitigate the virus.
One other area which the plan doesn't go into a huge amount of detail in is how the virus will affect those in the gig economy. This is important for a huge number of people, from Uber drivers to Airbnb hosts, who could see their work dry up if they're affected by the outbreak. Business Secretary Alok Sharma told MPs those on flexible or 0-hours contracts may be entitled to benefits or employment and support allowance, although the details still aren't completely clear. In addition to the comments from ministers, the NHS also commented on how it plans to react to the outbreak. A virus like this obviously hits the NHS hard, especially in the winter, where the health service is already handling a huge number of patients, with more conventional winter flu symptoms. In fact, Labour leader Jeremy Corbyn commented on the potential crisis facing the NHS, saying that the service was already at 94% bed occupancy, before having to handle the influx of coronavirus patients, and losing staff to the virus. In the NHS's official statement, they said that the health and social care system is also planning for the possibility of reduced staffing in hospitals and in the community in order to mitigate against these risks. Depending on the pressures in the system in the months ahead, trusts, which include health services, may have to consider postponing elective appointments and surgeries to focus on the immediate demands associated with coronavirus. This kind of prioritisation isn't at all surprising, and given the infectious nature of the virus, it's likely that those having elective surgery might choose to avoid hospitals, even if given the choice to go ahead. The NHS isn't the only one taking precautions either. The UK's biggest chemist, Boots, has told reporters that they've observed a major increase in demand for hand sanitizer. As such, they've announced that they're implementing a limit of 2 hand sanitizers per person to try and ensure that everyone has access, and to prevent online resale, with similar products selling online for huge markups. Before we finish, there was one last announcement which came out on Wednesday. The government has made changes to statutory sick pay, So anyone who is self-isolating no longer has to wait 4 days before getting statutory sick pay. Instead, it now begins on day 1. This change is only temporary, but Johnson has said that those self-isolating shouldn't be penalised for doing the right thing. However, it is worth noting that statutory sick pay is only £94.25 a week, so these changes would only earn you about £40. As I mentioned at the beginning, we discussed the coronavirus in the latest episode of our podcast, Too Long Didn't Read. So if you want to hear our thoughts on the virus, there's a link to the podcast in the description. Also, be sure to subscribe to the channel if you want more updates on the coronavirus as it develops, and hit the bell icon to be notified every time we release a video. Special thanks to our Patreon backers who make videos like these possible.